Hello, my name's Alex Schadenberg. I'm the Executive Director of the Euthanasia Prevention Coalition, and I'm wanted to comment a bit on the Washington State Bill HB 1141, which is a bill to expand the state-assisted suicide law in that state. One of the themes I have about this bill is that we don't want same-day death, no same-day death. So House Bill 1141 is sponsored by the same representatives who sponsored House Bill 2419 in 2020. So HB 2419 was a bill asking the state government to fund a study to be conducted at the University of Washington to determine how to expand the state-assisted suicide law. It was also known, which is also known as the Death with Dignity Act. House Bill 2419 would have then examined the expansion and elimination of safeguards of the assisted suicide law, and it would not have only influenced Washington State. It would have influenced other states in the same way as the current bill 1141 will do. 2419 passed, but the governor vetoed the bill as a measure to save money during the COVID crisis. HB 2419 sought to examine the following: a lack of awareness of the Washington Death with Dignity Act and its provisions, burdens for qualified patients to meet the 15-day waiting period. So obviously it was questioning the need for the 15-day waiting period. Concerns that inhibit the participation of healthcare providers in the provision of this chapter, meaning the law. Hospital, medical, hospice, and long-term care providers policies that restrict participation in assisted suicide. Limited geographic access to compounding pharmacies or other pharmacies to dispense medications under this chapter. Now, why that's important is the assisted suicide drug lethal cocktails that have been developed in Washington State. And I'll get into that in a minute. Restrictions based on the requirement that the medications in the chapter be self-administered. Well, if the drugs are not self-administered, then someone else will administer, which is euthanasia. To look at the lack of insurance coverage for these services and the medications necessary to participate in assisted suicide, the need for improvement for data collection systems, and any other barriers identified. Clearly, the authors of 2419 were interested in expanding assisted suicide to eliminate or reduce the 15-day waiting period and permit non-physicians from approving and prescribing, but also they were wanting to look at the question of permitting euthanasia, which of course, as I said, is homicide. Nowhere in the US is euthanasia legal. HB 1141 will expand the list of who can prescribe lethal drugs by changing the requirement from physician to qualified medical provider that they have defined as physicians, which were already part of the legislation, or a licensed physician assistant, or an osteopathic physician, or an advanced registered nurse practitioner. This lessens the qualification to approve and prescribe lethal drugs. And we're talking about controls, we're talking about lethal drugs. HB 1141 will also expand the list of who's eligible to counsel a person. Now, counseling is only done when the qualified medical provider is concerned about the ability of the person who's requesting to consent. So those who would be qualified to offer counseling in the current law are state licensed psychiatrists or psychologists. This includes then, would expand to include independent clinical social workers, advanced social worker, mental health counselor, or psychiatric advanced registered nurse practitioner. So in fact, they're just going to expand the number of people who can counsel somebody who has limited ability to consent or might be depressed. The bill eliminates the 15-day waiting period and replaces it with a 72-hour waiting period. Now, the 72-hour waiting period, though, can be waived if the qualified medical provider believes that the person may be dying. That allows for a same-day death. This is very important. Studies with people who are dying conclude that the will to live fluctuates. So removing the 15-day waiting period or allowing for a same-day death, as this bill actually does, actually removes choice at the end of life because a person's bad day becomes their last day. The existing approval and reporting system already denies effective oversight of the law. The law already allows the same physician to approve assisted suicide and then prescribe the assisted suicide. And then the same physician is then required to report the assisted suicide, which you would recognize then as a self-reporting system. that protects the physician who participates in assisted suicide and makes effective oversight of the law impossible. Now, why am I saying that? There's no third party outside, independent person who's overseeing the law to make sure it's being followed. You already don't have effective oversight of the law in Washington State. HB 1141 allows the lethal prescription to be delivered to the person rather than requiring the lethal drugs to be accessed by the person or by the physician. Now, why are they doing this? Well, they already said they have a problem with the number of compounding pharmacies based on these new lethal drug cocktails that they're using for assisted suicide. The problem with this is that we've heard a lot about these deliveries being stolen from people, meaning you hear a lot during COVID that people are ordering a lot of things online. Therefore, you hear that the deliveries that were coming to people's doors have been stolen. This provision then allows access to lethal drugs. The Washington State report, the most recent report that we have is a 2018 report. It reported that there were almost 25% more assisted suicide deaths in 2018 over 2017. The data in the report indicate that there were 203 reported assisted deaths in 2018, which was up from 164, 267 lethal prescriptions dispensed, which was up from 212 in 2017, 29 known natural deaths, so 29 of the people who received the lethal drugs died a natural death and never took the lethal drugs, 19 unknown deaths, and 16 where the death status was still pending. So that could be somebody who was prescribed the lethal drugs in December or November, and they have not yet died by assisted suicide. The 19 unknown deaths means that the Washington State Assisted Suicide Authorities knew the person had died. They just didn't know how they died. They never received the report. There was no report received. They don't know if the person died in a natural death, and they don't know if the person died by assisted suicide. So you may very well have unreported assisted suicide deaths in Washington State, but it also shows you the lack of oversight of the law. Remember, we're talking about lethal drugs here, controlled substances, in fact. There were more complications in Washington State in 2018, likely related to the new lethal drug cocktail experiments. The report states that there were 8 people reportedly experienced complications in 2018, which was up from 4 in 2017. Also, 62 people died in 2018, more than 90 minutes after taking the lethal drugs, and the range of time to die ranged in 2018 from 7 minutes to 30 hours. The Medical Express reported on September 8, 2020, a little-known secret not publicized by advocates of aid in dying was that while most deaths were speedy, others were very slow. Some patients lingered for 6 or 9 hours, a few more than 3 days. Assisted suicide is obviously not what it appears to be. Many people support assisted suicide based on the fear of dying a bad death. Assisted suicide can cause a bad death. The lethal drug cocktails that were developed to lower the cost of assisted suicide, had known side effects. The Seattle Times reported in March 2017, the first Seconal alternative, Seconal was the drug that was traditionally used in the past, turned out to be too harsh, burning patients' mouths and throats, causing some to scream in pain. The second drug mix has led to deaths that stretch out for hours, and in some patients up to 31 hours in one case. An article published in The Atlantic in January 2019 stated, an advocacy organization called End of Life Washington briefly advised prescribing a drug mixture with the sedative chloral hydrate to about 70 patients. We know this is going to put you in sleep, and we're pretty sure it's going to kill you, said Robert Wood, a medical director of that organization. He said he told his patients, it worked out, but with a tragic catch. In a few cases, the chloral hydrate burned people's throats, causing severe pain, just as the time came where they expected relief. Suicide promoters developed these lethal drug cocktails by doing human trials rather than animal trials first. The team appeared concerned with the lethal efficacy and cost of the lethal cocktail as opposed to the possible negative consequences with the use of these drugs. Were these human trials done with full consent of the participants? Now, why do I ask this question? We know those people have been approved for assisted suicide. What we don't know is if they actually consented to being part of a human death drug trial. So HB 1141 expands the assisted suicide in Washington State by reducing the 15-day waiting period to 72 hours, and then it allows that to be waived, permitting a same-day death. It allows for lesser qualified medical providers to approve and prescribe lethal drugs, controlled substances. HB 1141 creates a dangerous precedent that may be followed by other jurisdictions that have legalized assisted suicide. It is not necessary. HB 1141 needs to be defeated. You need to contact your members of the legislature, telling them that it's not necessary in any way to expand the assisted suicide law, but in fact, what needs to happen is we need to actually have oversight of the Washington State Assisted Suicide Act, not the opposite.